In this video, we're going to be talking about the medical options to treat fibroids. There are a few different classes of drugs available, and I'll just try and give a quick overview of what they are. The first option are simple non-hormonal tablets that work to reduce the bleeding and the pain that you can get with fibroids. Cyclocapron works to reduce the bleeding, and Ponstan or any other what we call non-steroidal anti-inflammatory works to reduce the pain. Combining both of these together, we know, has a synergistic effect, which means they amplify the effect of each other and give a much better result. They are used simply in the first few days of the period, and if that's controlling the symptoms and the fibroids are not growing, no further intervention is needed. The next option is oral contraceptive pills or the mini pill. These are basically hormonal treatments, and they again work to reduce the bleeding and pain with the fibroids, but have no effect on the fibroid size. The next option are specific treatments for the fibroids, known as selective estrogen receptor modulators. They can work very well, but the most recent one that we had, which was fairly effective, also had some issues regarding the liver, so it is not widely used now. Gonadotrophin releasing hormone agonists are basically drugs that mimic the normal hormones that are released from the brain that work to get the ovary to produce estrogen and progesterone. But when you give them in a constant dose, they actually suppress the function of the ovary, so they give you like a temporary menopause. By doing that, they're reducing the production of the estrogen, which in turn takes away the chemicals that are feeding the fibroids to grow. They're very effective and can often be used prior to surgery to try and shrink down large fibroids or instead of surgery. Gonadotrophin releasing hormone antagonists work to basically block the normal gonadotrophins that are released from the brain. Again, they stop the ovary producing estrogen, and that way you're not feeding the fibroids to grow. They've been developed over the last few years and have very, very promising results. There are currently 3 different medications on the market, but unfortunately they're not available in the Gulf or UAE region at the moment, but I'm sure in the coming years they will be. The remaining management options are really what we term other. They're basically the current research options that are being developed. The most important one are looking at ways we can affect the mixed up genes, if you like, the ones that are not working to control growth of fibroids, to get them to work properly and reduce development of fibroids. And this will take another few years, but does look quite promising. So these are the current medical treatments for fibroids. The first 4 are readily available here in Dubai and the UAE. All you need to do is discuss these options with your doctor, and they'll be able to work out with you which is the most important or appropriate regime for you. Hope this is helpful. Wishing you a great day.